Find the morning people. Good morning, good morning. We love you and we are so grateful that you're here with us for another day. Some of you have been here since our annual meeting. Some of you arrived yesterday. Some of you arrived just before the gala, but I just want to say again, welcome. Good morning to each and every one of you. We thank you for taking time away from your home, your family, your places of work, packing and traveling and sleeping in a bed that is a little unfamiliar so that you can connect with your family, your workforce, your partners, your allies, and with the National Association of Community Health Workers. Are you enjoying yourself? Okay, I'll take a temperature check on that. What about the workshops? Can we clap it up for all the workshop presenters and co-presenters? Okay, all right, we're getting a little better. What about the Founders Circle panel from yesterday, where you heard some of the history that you probably have never heard before about our profession and how we grew to become NACHW? Okay. What about the policy panel, where you heard from female leaders across the country on how to develop policy strategy and advocacy, how to cultivate your leadership voice? Okay, all right, it's getting a little better. What about the love doctor, Dr. Darrell Brooks? Ah, yes, we needed love in the house, helping us to understand that love can be a defense, that it can promote our safety, that love can be a protection, that love can be a source of nourishment for each and every one of us. Sounds like we enjoyed that. We had an amazing keynote yesterday, and we have an incredible keynote today. And my hint for you is she has a table in the exhibit hall. She is selling her books, or probably she's giving them away, because that's her heart. And so if you have not been to our exhibit hall, we have an incredible speaker for you today during the lunchtime, so please do not miss it. Is there any doubt in your mind that community health workers are the workforce we need for the world that we want? Is there any doubt in your mind? Okay, well then welcome to day 2 of the 2023 Unity Conference. I have one more shout out and then a few announcements before we begin. Can we just celebrate DJ Kick It for the awesome gala dance party we had last night? Oh, I know some of you must not have been on the dance floor. I mean the people who were on the dance floor last night. Can you just wave? And I saw my folks out there. I saw you out there. Oh my gosh. I won't put those shoes again on for, I don't know, another 3-4 months. I've put them up on the shelf, literally. Just a few announcements as we begin this morning. So last night at the gala, one of the things that we did was recognize and introduce to you those board members who were newly elected from our annual meeting and who are going to come into the fiscal year 2024 board of directors. There was one newly elected board member who could not be at the gala last night, and her name was not mentioned. You didn't see her. So I just want to acknowledge, and I don't know if she's in the room, but Sarah Seelig, are you here in the room? See, now we know Sarah's not a morning person. That's okay. We have no board meetings before noon on any day, in any time zone. So I just want to acknowledge that Sarah Seelig was also a winner of a seat on the board of directors because of your vote. She was unable to attend last night, but she'll be installed at the first board meeting following this annual meeting. And so the board of directors is already preparing for their first meeting for this month. So let's just celebrate Sarah and her new position. Sarah, we thank you in advance for your service, and for all the newly elected board members, again, congratulations. So just a few more things. Do we have any 2019 NACHW ambassadors who are in the house? Oh, I love that the light went up. Could you please stand if you are a 2019 ambassador? Yes, that means you. Yes, that means you. Where's my leader from Connecticut, Milagrosa Seguino? Is she in the room yet? My leader. Okay, yes. Thank you, thank you, thank you. I just want to celebrate the 2019 ambassadors. They came on at the Unity Conference in 2019. I met them in November 2019, and they had plans for just an incredible year of outreach into 2020. And then, of course, you know, the global pandemic came to the shores of North America. Nevertheless, these ambassadors helped us to stretch across the country, to make meaningful connections, and that's one of the reasons why our membership has grown and we are now in all 50 states. So I just want to celebrate those ambassadors. You may have not seen them the way that we envisioned, but nevertheless, they were serving in incredible ways. Do we have any 2023 ambassadors in the house? If you are a 2023 ambassador, some of them are volunteering right now. Okay, thank you. Yes, thank you. Thank you very much. Some of them are wearing their white t-shirts. You've seen them with the blue lettering. I also really want to acknowledge that CHWs, they are volunteering their time to grow this organization in incredible ways. And one of the ways is by being a National Association of CHW ambassador. These are the CHWs who were selected to continue the work of amplifying NACHW. And I just want to thank you for your expertise, for your spirit of collaboration with us, your compassion, and for all that we will accomplish together. So thank you so much. Okay, so again, if you haven't done so, we invite you to visit the exhibit hall at 10 a.m. this morning. We have a poster session, okay, in the back section of the exhibitor hall. So if you haven't walked through, I think we have over 60 booths there. But please, let's come out and support all of the CHWs and their allies who are going to be presenting in their poster sessions, some of them for the first time. And this is one of the pathways for people who have not presented at a national conference before, so we want you to come out, we want you to support them. Next year, we expect to see them presenting their own workshops, their own trainings, their own sessions here at Unity. Okay, so I believe I'm good with all of the announcements. Last night at the gala, I also briefly took some time to introduce Kate, who was the VP of Client Success from Care Coordination Systems. And as many of you know, Care Coordination Systems for the past 3 years, this is the first year in person, they've been a conference title sponsor for the Unity Conference. So some of you, when you come into the exhibit hall, you see their sort of oversized booth. They've got a freezer there with some ices, and you can take some photos and things like that. So go do those fun things. But I also spent some time at their booth and recorded a short video with them, and so we just want to share that with you now. So hi everyone, my name is Denise Octavia Smith. I'm a community health worker and I am the inaugural executive director of the National Association of Community Health Workers. And today I am in Austin, Texas at the Austin Convention Center celebrating the 2023 annual meeting of the National Association of Community Health Workers and our Unity Conference. And so I'm sitting in this fantastic booth that makes me think of a wonderful vacation, and I just wanted to spend a moment and acknowledge and celebrate our conference sponsor, Care Coordination Systems. So CCS has been a conference title sponsor of our Unity Conference for the past 3 years. And now we're in person, right?
Yes, so happy to be here in person.
Yeah, we've always done this virtually. So they've created this incredible booth, and I just wanted you to see us in it and tell us a little bit about what you're doing today.
Yes, well, I'm Keezy with CCS Health, and we're so happy to be here and spending time with everyone. We really created this booth, just a place for people to gather and relax and recharge. We have outlets for charging your phones. We have freezy pops and water just to hang out and really to support you. So we are auctioning off all of the furniture in our booth if you're able to be local or can take it away. And we also have some cameras available for auction. And so really we just want to get to know you and have some chats and learn about what you're doing in your organization.
Fantastic. So first you need to come on down to the exhibit hall. It's on the first floor of the Austin Convention Center. And I also just want to say that CCS really believes in the work. They believe in community health workers. They hire community health workers. And one of the folks here at the booth today who's a staff member of CCS was a CHW. So hi, how are you?
Hi, my name is David Rowan, and I was a community health worker for about 7 years. And then I moved into managing community health worker programs. And then from there, I've joined the CCS team and working with them to help other CHWs really capture the work they're doing and be reimbursed equitably for it.
Yeah, one of the things we're talking about here is how we unify this very diverse profession, how we advocate for this profession, and how we sustain this profession. And so again, Care Coordination Systems has a really successful model that centers the social determinants of health and that really respects the leadership and the expertise of community health workers. So I just want to say again, thank you both on behalf of the National Association for being our conference title sponsor. We really do appreciate it. We can't do it without you. And everyone, please take today or tomorrow to come on down to the exhibit hall, or if you're watching this sometime after the Unity Conference, why don't you visit the Care Coordination Systems website and find out more about them. Thank you.
Thank you.
Thank you.
And thanks again, CCS. Okay, so if you were with us yesterday, many of the discussions that took place in this ballroom, and I would imagine many of the conversations that took place in our workshop rooms came across or intersected with or focused on the issue of sustainability. We heard it in many different ways in all of the panels that I either introduced or was a part of. And one of the things that one of our board members during the Founders Circle, I believe it was Julie Smithwick, said, she was looking at all of these banners. I think you know these banners represent something that we call the 6 pillars. It was created really just to try and compress a description of community health workers, something that you could use in a presentation that might take you 10 or 15 minutes instead of 10 or 15 hours, but that nevertheless would encompass the fact that we are unique, that we are an unduplicated profession, that we are historic and diverse, that we represent nations all over this world, even here in the United States, that we are across race and language, ethnicity, gender, culture, faith, sector, and lived experience, that we are community-based, that we might work in many different settings, health systems, health plans, public and private institutions, but we are best when we are standing alongside of the community members where we emanate from, so that we can stand shoulder to shoulder to advocate and realize the vision for our future. That we are cross-sector, that we're not waiting on clinical or community integration or any sort of initiative to do the work of a CHW. You have to understand the whole health needs of individuals and families. And while we're not always paid to address housing or food, we may only be working in a diabetes program, we are stretching. We are boundary spanning so that we can help individuals and families get everything they need to realize their health and well-being. We are proven. We have over 6 decades of evidence of effectiveness, and no disrespect to the researchers, because many of the researchers in this room have helped us to confirm our value through critical data, but now we need to take that data and move it to action. And then Julie Smithwick said, we are precarious. And she said, one day, I hope that that one pillar will change, and that we will no longer be precarious. And one of the reasons that we remain a precarious workforce is because we have experienced over the life of our workforce here in the United States short-term, siloed grant funding or contracts that often minimizes our roles or our scope of work, that often does not center our leadership, our advocacy, our self-determination, or our self-actualization, that we remain the lowest paid of all public health professionals. And so even in one of our sessions yesterday, there was a conversation about Medicaid. Many of us are serving populations who are eligible for Medicaid or are dual eligibles. We heard yesterday in one of the policy panels that in states that have not expanded Medicaid, those needs are even more dire. But there is no doubt that because Medicaid is a state-run program, it is critical to the work that each of you are doing in your respective geographies. And so I mentioned yesterday, and I'm really pleased to report that today we have comments that are coming from Chiquita Brooks-LaSure, who is the administrator of the Centers for Medicaid and Medicare. I want you to know that I met her when I was down in DC, and I really thought she was just going to sort of brush me off. And I sort of said, well, you know, we're doing this conference. And she said, invite me and I will come. She was unable to be with us today, and I do apologize, but we were able to pull together a video from her. And so she is here to talk to you about the CMS perspective of our unique and cross-sector and proven workforce. And I just want to tell you a little bit about her in case you are not familiar with her and her work, and then we'll share a short video. So Chiquita Brooks-LaSure is the administrator for the Centers for Medicare and Medicaid, where she oversees programs including Medicare, Medicaid, the Children's Health Insurance Program, CHIP, and the Affordable Care Act health insurance marketplaces. A former policy official who played a key role in guiding the ACA through passage and implementation, Chiquita Brooks-LaSure has decades of experience in the federal government, on Capitol Hill, and in the private sector. As Deputy Director for Policy at the Center for Consumer Information and Insurance Oversight, some of you know that as CISIO, within the Centers for Medicare and Medicaid Services, and earlier at the Department of Health and Human Services as Director of Coverage Policy, Brooks-LaSure led the agency's implementation of the Affordable Care Act, coverage and insurance reform policy provisions. Thank you so much for the video, which is coming now.
Hello, I'm CMS Administrator Chiquita Brooks-LaSure, and it's a pleasure for me to be able to speak to the National Association of Community Health Workers, your annual meeting and Unity Conference. The work that all of you do every day supporting your communities, advancing health, equity, and social justice is making an enormous difference and contribution in the lives of millions of people, especially in our most historically disadvantaged populations. As our landmark 2021 issue brief from the CMS Office of Minority Health outlined, community health workers play an integral and unique role in helping healthcare organizations achieve health equity. As frontline health workers who are members or who have a deep understanding of the communities you serve, you can best address both the clinical and the critical social needs of individuals and families, especially within organizations that aim to support vulnerable populations. That's why you're so uniquely positioned to improve healthcare quality, reduce provider burden, and strengthen relationships and trust within the communities you assist. But we know that this work cannot be done alone. We want to be partners in your efforts. And that's why last year we issued a request for information on Medicare Part B payment for services involving community health workers. And now we're proposing for the very first time separate coding and payment for community health integration services in the calendar year 2024 Medicare physician fee schedule proposed rule. This would be the very first physician fee schedule services designed to include the care that involves all of you, community health workers. If finalized, the services would include person-centered planning, health system coordination, promoting patient self-advocacy, and facilitating access to community-based resources to address any unmet social needs that interfere with a practitioner's diagnosis and treatment of a patient. The new services are also building on CMS's commitment to health equity by helping you and your work to link to those you serve with critical healthcare and social services in your communities. This is vital because we all understand that we cannot achieve healthier communities if we don't first address health equity. As the first African American woman to head CMS, I've made health equity the foundation of everything we're doing. We want to ensure equitable access to coverage and care, and to ensure that our programs are operating to reduce the health inequities that underlie our entire healthcare system, which were especially illuminated by the COVID-19 pandemic. We are working hard to break down barriers to care and to lift up all underserved communities. That's why earlier this year, we released an update to our comprehensive health equity framework. It provides an integrated, action-oriented approach for CMS to advance health equity among members of communities who have historically been underserved or disadvantaged. One area of focus is improving maternal health. We all know that there's a maternal health crisis in our country. Black, American Indian, and Alaska Native women are on average 3 times as likely to die in childbirth as their white peers, and disparities persist across income level and education. That's why last July, we released our CMS Maternity Care Action Plan. This plan takes a holistic look at our authority to improve health outcomes and to reduce inequities for people during pregnancy, childbirth, and the postpartum period. And it uses all of our levers to make improvements to the care people receive during and after pregnancy. Overall, we're looking at all of our policies, agency-wide, through a health equity lens. As we do, we're working to advance equity and access across what I like to call the 3 Ns: Medicare, Medicaid and CHIP, and the marketplace. Having health insurance is a lifeline, not a luxury, but it's only part of the answer. We want to ensure that people we serve get the care that they need and deserve, no matter what they look like, where they live, or how much money they make. For example, in Medicare, we're working to enhance equity and address disparities in our payment systems and design our innovation center models with equity in mind. In Medicaid, we've rolled back restrictive policies, including work requirements. And as you may know, we're offering an option for states to provide 12 months of continuous postpartum coverage through their Medicaid programs. That's up from only 60 days at a time when most families need it most. And I'm happy to tell you that 35 states and the District of Columbia now offer a full year of coverage. As a mother myself, I can't imagine simultaneously juggling a new baby and trying to find new health insurance. We're also working to advance access and equity by ensuring that the promise of Medicaid and CHIP is never broken for those who need it. As you're aware, during the COVID-19 pandemic, we ensured that people could stay on Medicaid or CHIP so that they wouldn't be at risk of losing their health care in the middle of a pandemic. No one had to worry about renewing their Medicaid coverage. But for the first time in 3 years, states are now returning to regular Medicaid renewals. We need to make sure that everyone knows that this is happening and what they need to do to renew coverage. This is an all hands on deck moment. We need your help to spread the word about Medicaid renewals. We especially need your help to make sure that people with Medicaid and CHIP coverage have updated their contact information and that they know to check their mail and return their renewal form right away. I want to assure you that we've been working with states to make it as easy as possible for them to keep people covered. But it probably won't surprise you that some states are doing a much better job of this than others. We've been seeing too many people lose coverage because of red tape, not because they're not eligible. I and everyone at CMS are deeply concerned about eligible people losing healthcare coverage. That's why we're doing everything in our power to help them stay connected to care. We're closely watching data, both for Medicaid and Marketplace, and we're using that data to monitor states and ensure that they are meeting federal requirements. And let me be clear, we're not hesitating to use all of our enforcement tools to get states to do what they're required to do through the renewals process. We've also announced a new temporary special enrollment period from now until July 31st of next year. If someone has lost Medicaid or CHIP coverage and their state uses the federal marketplace, they can visit healthcare.gov, look at their options, and submit or update an application to take advantage of our unwinding SEP. We're also working with states with state-based marketplaces to do the same. And thanks to the Inflation Reduction Act, premiums for insurance on the ACA marketplace are now more affordable than ever. When the application is submitted or updated, people will have 60 days to select a coverage option. More information about all of this is available at Medicaid.gov. I know that many of you have been hard at work helping people stay connected to Medicaid coverage. Thank you. We truly appreciate your efforts. And as folks who are on the ground, directly connecting in your communities, we desperately need you to continue your work. Once more, this is really an all hands on deck effort. I'm asking each one of you here today to go back to your neighborhoods, go to your communities and organizations, and help get the word out about Medicaid renewals and the options for affordable health care. We just cannot do this without you, just as we need you to always be our partners in our efforts to ensure that every person can access affordable, high-quality health coverage and enjoy the best possible health. I know that the work you do every day in your communities, including historically underserved communities, is helping countless individuals and families to enjoy better health and better lives. I'm so grateful for what you do, and so are the American people. Let me also add that what you do is never easy, but it is always right. And as President Barack Obama once said, nothing in life that's worth anything is easy. Well, I can't think of anything more worthwhile than what you do. Thank you, and I wish you a very successful annual meeting and conference.
I can only imagine that many of us would love to jump right into discussion. And the good news is that immediately after this session, and in just a moment, we are creating space for the hundreds and hundreds of folks who are here today to meet in regional groups, so in smaller groups, and to have discussion. We'll have a facilitator. It's not a panel, it's not a presentation, it's a time for you all to come together. Briefly, I just want to touch upon two things with the limited time I have remaining. One, you heard in the policy panel that indeed there is a physician fee schedule proposed rule that does include language around community health workers. The deadline for response is September 11th. And so I believe you heard some comments about that yesterday. NACHW will also be providing responses. Also, back in September 2022, CMS had a request for information regarding CHW's roles in Medicare Advantage. And it was interesting because as we were considering the RFI, it almost seemed as if the folks on the Medicare side had not been really consulting the folks on the Medicaid side. And so I really just have a moment. I'll direct you to our website, to our policy page. You can see the full letter that we submitted in terms of our RFI. But I just wanted to say this so that you have an understanding of the priority areas when we think about CMS and CHW's roles. And I'm just reading a one paragraph excerpt, so please go to the entire letter. Our recommendations that follow are informed by the experiences and input of our CHW members who are employed across sectors, including clinical, behavioral health, social, and community-based organization. We apply an equity and social justice lens by prioritizing the lived experience of CHWs, rather than limiting our focus to, quote, evidence or, quote, best practices gathered from research interventions in well-resourced environments. Here we provide a brief summary of our recommendations in 4 areas, and additional details on each point are included. So I will give the 4 headings, and then please, I invite you to read the entire letter. These are the 4 areas that we are recommending for CMS to start. And again, this goes back to the conversation about broadening the definition of sustainability. Number 1, adopt the full American Public Health Association CHW definition and the CHW Core Consensus Project C3 role scope of practice. In much legislation, there is no definition of our profession. And so without a definition, talking about our lived experience, our identity, our centeredness in community, and the fact that we are a unique and unduplicated profession, we run the risk of just anyone being hired as a CHW. So this is a real foundational issue for us. Thank you. We want to protect the OGs who've been doing this for decades without a title, without recognition, and without pay. Number 2, we're asking CMS to promote equitable payment and pay CHWs for their lived experience. Codes are not enough, okay? The codes are relevant, but we need to make sure that CHWs are receiving a thriving wage with the same benefits and opportunities that other professions enjoy who receive reimbursement or payment from CMS. Number 3, we would like CMS to embrace the CHW-driven evaluation and consult the National CHW Common Indicators Project. We believe that one of the reasons that many of the initiatives, the research projects, the interventions that include CHWs, even when they show evidence of effectiveness, one of the reasons that they are not sustained, right? You wonder, why would a hospital, a health system engage in this research, identify positive health indicators or outcomes, but yet not sustain the project? Why doesn't it make it to their operations budgets? Often that is because there are not evaluation indicators that talk about the unique role of the CHW. So after the intervention is seen successful, people then say, okay, great, well, let's let the LPN do that, or let's let the medical assistant do that. Let's have the social worker do that. So we need evaluation indicators that elevate and clarify what the unique expertise and the role of the CHW is, and the common indicators help to do that. And then finally, eliminate funding barriers for community-based organizations that employ community health workers, promotores, CHRs, and others. Our CBOs have been harmed during this COVID-19 pandemic. They have been asked to do an outsized burden. They have asked to be on the front lines without access, with numerous eligibility and administrative barriers. In many instances, they were competing against large academic institutions or large health systems during the COVID pandemic, even when the funding models said CHW or community-based organization. We need an equity lens to this work, and so we ask for these foundational principles to be that source upon which CMS builds a better model as it concerns the integration of CHWs. Thank you so much. Was that too much for early in the morning? I know it's early in the morning, but we don't have a lot of time together. We have to cover a lot of ground, right? I know it may seem like a lot of information, and you all see how long-winded I am, but we just love you. We want you to be connected. We want you to know what we're doing. So now you've been seeing for the past minute or so on the screen the breakout groups that we're inviting you to participate in. Again, as I said, this is you can sit and listen, you can lean in, you can step back, but this is an opportunity for you to talk amongst yourselves, first geographically, okay? And there are some issues, some opportunities for sharing, for alignment, for strategy development at the regional level. Beyond that, there's an opportunity for you to meet others within your state or within your region that you want to collaborate with. And so I'd ask all the associations, the networks, the alliances, all that leadership, please attend these meetings, make yourself known, the training centers, so that CHWs who don't have an association, they have not had access to training in their state, can find out about your online trainings or the other opportunities that you may offer. Finally, this is also an opportunity to strategize about policy more generally, and also the National CHW Awareness Week. Please urge those who are going to be in the breakouts to take part, even if you just post on social media during that week. If you're laying on your couch and you just have the energy to post, we would love for you to be a part. We've provided a toolkit for you with agendas and checklists so that you don't have to do the heavy lift of thinking about it. We've provided sample letters for you to send to your legislators. So we urge you to find a way to connect with us during the Awareness Week that begins August 28th. My time is up. I want to thank you for an incredible morning. The workshops, the poster sessions, the exhibit hall, and the incredible keynote we have for you today. Please enjoy day 2 of the 2023 Unity Conference. Take good care, everyone.